Welcome. This is Jean Eaton of Information Managers. It is my honor and pleasure to be with you today at the Practice Management Nugget. This is a weekly interview series with practice managers, healthcare providers, or trusted vendors who support healthcare practices. Our topics help primary care practice managers, healthcare providers, and owners to implement, maintain, or improve their business and practice administration so that healthcare providers can focus on providing quality healthcare services. I am your host, Jean Eaton, the Practice Management Mentor with Information Managers. Today, I am delighted to be able to introduce Karol Clark to our show. Karol is formally trained as a master's prepared registered nurse in the field of women's health, medical and surgical weight loss, and nutrition. Her passion is for helping her husband, Dr. Thomas W. Clark, at the Center for Weight Loss Success, use engaging automated systems to not only reach his ideal patients, but optimize the results and satisfaction with quality education. This ongoing engagement builds a tribe of loyal patients and an effective referral base. She and Dr. Clark have also created an effective travel weight loss surgery program for patients who live outside of Virginia and a digital weight loss program that any practitioner can integrate into the practice to help their patients who are overweight while adding an additional stream of revenue. Karol, I'm delighted to have you here. Thank you.
Thank you, Jean. It's my pleasure to be here today as well.
And Karol, tell us where you're from.
I am actually here in Newport News, Virginia, and I live here with my husband, and we have 4 children.
So you're a busy mom too.
I am enjoying it.
Good. That's good. Karol, I am so thrilled that you're here with us today, and I particularly wanted to share the story of how we connected. I met you during an online event with Mike Konings, who is a speaker and mobile and video marketing expert in the U.S. In fact, you were online at that event, and I noticed your online profile. So using the magic of social media, I followed your profile on LinkedIn and then sent you a direct message to invite you as a guest, and now here you are.
That's right.
So social media really does work.
It absolutely does.
Okay. So what is your story, Karol? What is the Center for Weight Loss Success?
Sure. As you mentioned, I'm a registered nurse, and I work with my husband, Dr. Thomas W. Clark, and we have a passionate staff here at the Center for Weight Loss Success. And what we really do is help motivated people lose anywhere from 5 pounds to hundreds of pounds, but not only lose weight, but really understand how to keep it off for life, so they live their life full of energy and free of the disease called obesity. We really have actually a lot of fun here and enjoy helping people really make their dreams come true with surgical and non-surgical weight loss and fitness services and products.
I have spent a little bit of time on your website and looked at your Twitter feed and your LinkedIn and your YouTube, and you've got so much stuff happening. How did you get to this point?
Well, that's a great question, because as a clinician, I really didn't always have a comfort level with using tools like this. My primary concern was counseling the patient, taking care of patients. But what I found was, as our practice developed, we would pay people, different marketers, different avenues for getting the word out about what it was we had to offer. We would pay them to provide those services, and oftentimes we were met with feeling like we were paying for mediocrity and really a poor return on investment. And so as online tools and social media came about, I really started delving into it and found it to be a very cost-effective way to reach the clients that you want to work with, and also a really exciting way to take some of the knowledge that you've had over the past 24 years. We've developed quite a few educational materials, and really turn that into something that can help people on a broader perspective versus just right here in our little town of Newport News, Virginia. So now we're able to reach people anywhere across the globe, and it's pretty exciting. And I find that with the way people interact today, they really want that sort of interaction as they have such a fast-paced life. So it's really become quite a effective way for us to reach a larger audience and actually help more people in addition to the awesome clients that we have here in Virginia.
You've said some things that I find really important. You reused information that you had already had created. So it wasn't all just creating something new and exciting and putting it out there for the first time. You reused information that you had already developed and just made it more available to more people.
Absolutely, and you can do that in lots of different forms, which we'll talk about today.
Okay. So where did you go from that? You identified a need. You found that you had an opportunity to create something in-house that was better than what you were purchasing from outside. So where did you go from there?
We actually just continued to build on it. You know, initially in healthcare, it's sort of it's an unknown out there, and we're all about, it's interesting because we do a lot of online education, but we're really more of a concierge sort of a service, so we like to have that individualized attention as well. So we've taken that information and we've balanced it with counseling here in the office too. Whenever people use a tool such as, I'll just use weight loss surgery as an example, if they have surgery and they don't have the education and the support to help them become successful, their results will not be nearly ultimately as good as what they could be with that support and education. So it's kind of like buying a car without knowing how to drive. So for us, even though it's something that's oftentimes neglected, to us it's really important, and yet it's really expensive to provide all that one-on-one counseling. So we combined some online tools along with individualized counseling so that you can make it a little bit more cost-effective, but yet still very individualized, so the client knows that they have a true support system in place and that will help them be successful versus just having an operation such as bariatric surgery and then not really having the tools and the knowledge of how to use that tool to have the ultimate results that they want.
Okay. So you're reusing and repurposing the materials that you're creating it already, providing it to more people, and your clients, are they finding better results? How are you evaluating your return on investment?
We do actually. We have we created a product called, a number of them, but the one that relates to weight loss surgery is called Weight Management University for Weight Loss Surgery. And so in combination with their visits with the surgeon and our coaches here and our personal trainers, they actually receive at their house a DVD every month, a CD, a full module with what to expect this month, what to expect next month, success stories, recipes, and information about weight loss in general that comes right to their doorstep. So they're receiving that one-on-one counseling. And in addition to that, they're also receiving, everyone learns different ways. Some people are auditory learners, so they have the CD. Some are visual with the DVD. And then also some people just like to read and hold that material in their hands. So for one full year, once every month for 12 months, they received these materials at home. So it was a way to offer that and package it into one product that we can actually then help people that whole first year after surgery, because that's when they're changing their behaviors. But we used to give it to them in little sort of snippets. And this way, it's all packaged, and at the end they have their whole binder with all of their, everything is neatly packaged, and they are a totally different person at the end of 12 months after surgery. And we have just found that the outcomes are exponentially better, and the success stories, we record at least one a month, and it's just been phenomenal, the feedback that we get from our clients about the awesome support and education that they had to help them not only lose weight but understand how to change their behavior so they can have long-lasting results.
Okay. It sounds like a nice way to be able to keep your patients engaged and keep them motivated on something that's a long journey. If you have to change your habits, it takes time to make that happen.
Absolutely, and it's hard.
What has the reaction been from your staff? What have they needed to learn to be able to use this effectively?
Sure. Well, I have to say, I think that for any practice, anyone on the call would probably agree that probably your two biggest assets are a loyal patient base and also a phenomenal staff that understands your message and is able to communicate that with a high level of customer service. So for the staff, they all have different roles, but they're like different parts of the cog on the wheel, and so they all understand what the role is for each person. So from the front desk all the way through to the person who runs helps me with our editorial calendar and getting all the information out and mapping out what we're going to be offering every single month. They all have one same vision that's set by Dr. Clark and myself. And so they all understand that, and then they can then articulate how all the resources, whether it's on-site or online, especially for our travel surgery patients, they can articulate that to the client so that they know what to expect. Our belief is that an educated patient has a better outcome. They just know what to expect, and so everyone's involved in that whole process, and everyone's just as important as the next person when it comes to communicating that to the patient.
Okay. So you've come up with the idea, you put some tools in place, you did some education and training with the staff so that they can then in turn provide some education to the patient. You're seeing patients with better outcomes, return on investment as far as a business perspective. What type of response or reactions have you been able to gain?
Well, here's what we've found. We have had an increase we've had a significant increase in terms of patient referrals, which are our favorite kind of referrals. So if you create happy patients, they'll refer additional patients, and that has been tremendous. It used to be about 30% of our referrals came from patients, about 30% from the internet, and another 30% or so from referring physicians. Well, in today's day and age, you still have the referral from the physicians, but oftentimes they're owned by a larger health practice and they have to develop their own referral patterns, and they still can send patients, but some of that can be a little bit dictated for them. So we've actually seen our patient referrals become a much larger portion of our referral base, as well as our online presence has increased the amount of online referrals that we've received. So that, and if you have a patient referring somebody here, they come in with the mindset that is preferable. They have a closer understanding of what it is that they're going to be experiencing and what to expect. And so it makes your job as a clinician and as a staff member here a little bit easier, too, because people come in with some expectations of understanding what to expect. Thanks.